My anesthesia case study presentation. My name is Jacob Bautista, and I'm a part of HL 400 with Dr. Christine Malone. So let's begin. Our patient is Dr. Derek Johnson. He is an anesthesiologist. He has 15 years of experience. He is board certified and does almost all of the procedures at his hospital. His age is 45, and he is, his condition today is a compromised immune system. Summary: Dr. Johnson is treated at Community Hospital of the West, which is his workplace. Septicemia from the abscess in his arm is caused from his compromised immune system, and it is likely due to injections. Coworkers bring up concerning observations after he is treated, and this sparks sort of gossip in the work area. Luckily, Dr. Johnson is alive, and hopefully he can recover from his situation. Employee observations. Colleagues noticed a change in the doctor's appearance. He has sort of a trashish look going about him, just a change in the characteristics. OR nurses notice issues with the doctor's morphine prescriptions, such as the doctor was prescribing morphine to patients who did not have any chief complaints of pain, and when patients did have some severe amounts of pain, they felt little to no relief at all when treated with morphine from Dr. Johnson. A nurse actually confronts the chief of anesthesiologists about Dr. Johnson's about her findings on Dr. Johnson. What happened to these employee observations were that the colleagues told themselves that it's probably due to his hectic work schedule of why he has such a tired-ish look going about. The OR nurses realize that the patients are the ones who suffer because of Dr. Johnson's addiction. He seems to only want to benefit from gaining the drugs for himself rather than to treat his patients. At this point, it seems as though he is an addict, and this was actually 6 months ago, because it shows that he is becoming dependent on the drugs, and he will resort to almost anything to get his drugs. The nurse that confronted the chief anesthesiologist is essentially told by him that he doesn't want to confront a colleague about this situation, and so he just ends the conversation, and the nurse never goes to anyone else with this information. Who is responsible? It's obvious that Community Hospital of the West is responsible for the outcome of Dr. Johnson's situation. They have to acknowledge the risk of anesthesia and what the anesthesiologists have to go through. They have to protect the patients, which they weren't able to do with Dr. Johnson abusing the prescriptions. They have to show support for employees. That nurse that brought up that issue, she was not given any support. There was no, she might have been seen as a whistleblower, and it seems like her voice was not cared for. They have to encourage employees to seek help. Had Dr. Johnson felt more encouraged to go to resources and maybe talk to a friend about his situation, he would have been saved. What are the flaws in community health of the West system? The controlled drugs are not monitored. It was easy for Dr. Johnson to just grab morphine. Let's say he prescribed 2 millimeters. He only used 1. That last millimeter he could have said he used. There was no reporting system. As I said, with the nurse, she had a brief conversation with the chief anesthesiologist, and the report or the conversation at the time was never recorded, and nothing was done with it. There is no resource center. It is noted in the case study that Community Health of the West does not have a resource center for their employees to seek help with. What what are the solutions? To create a resource program. Have a program that entices employees to come in and discuss their issues with drugs or narcotics. Make sure. I think that it would be a good idea to have no repercussions done to the employees that seek help. It seems as though what most resource programs have is that they suspend the physician's licenses and prevent him from operating or doing any procedures while he is in this program. And there is actually a majority of hospitals rehire or continue to keep their physicians that have gone through treatment, only if they self-refer. They need to make employees feel safe. By doing that, they need to stop the gossip rumors of from spreading. So if they realize that, okay, this is the situation, we need to put out an email telling everyone about what is going on, and they need to encourage their workers to come forward with information and help save a fellow employee. They need to have peer review. This has to do with the morphine situation where he was the only anesthesiologist at the time handling the morphine, and the nurses seemed to have noticed what was going on, but they didn't say anything. So I think that it was because they are under Dr. Johnson, so they need to have one other anesthesiologist come in and review, let's say a random review about what was going on with that situation. And then a post-operation survey again ties into with the morphine situation. Let's say we have a post-operation survey done by both the patients and the operating team, such as an anonymous one for when it is due to the team survey. I think this would help out with that whole misuse of morphine, because the patients, whoever reads these reviews will note that there's a trend in patients not feeling relief. I just want to touch back again with the Create a Resource Program to be able to reiterate to employees that there is nothing wrong with coming forward about your problems or addictions. I think that's a big issue going on with physicians feeling as though they will be made fun of or lose respect. Also, another big topic about the resource programs are that they need to have a 28-day step program. They need to make sure that they involve the patient's families, and it has to be a truly detoxifying program. And it would be great if the hospital or if they had insurance that could cover this whole program, being that it most likely would come out of pocket. The overall summary is that Dr. Johnson's situation could have been prevented had Community Hospital of the West had these resources and listened to their employees. Things would have been totally different for Dr. Johnson's situation. Like I stated, the employees used their voice, but to little avail. It seemed as though the only people that listened were themselves in this whole gossip situation. Community Hospital of the West is responsible for Dr. Johnson's situation because he is one of their employees and because he is essentially interacting with their patients. And it was shown before that he totally disregarded patient safety and welfare. Dr. Johnson could have been saved earlier. It was stated in the case study that had he had resources, but Community Hospital of the West did not have those resources. Thus, his situation escalated into what it was, of him seen at the hospital in that dire need of help. I just wanted to say thank you for tuning in. This concludes my case study.